and welcome to another episode of Natural Pets TV. I'm Robert Semro, and I am joined by Dr. Ken, Dr. Jodie, and Dr. Patrick. Dr. Patrick, you have a beautiful smile, and our pets need a beautiful smile, not just for the looks, but it is really critical for their health. Let's talk about that.
Well, periodontal disease is a huge, important topic to me personally, and also for my patients. So the mouth is a place where a lot of disease lurks, and a lot of that disease can actually get out and affect other body parts if we don't prevent it. And periodontal disease is one of the most preventable diseases, along with obesity, and it actually has potentially irreversible consequences. And that's why I want to have pet owners think every single day we need to focus on doing something to help to promote the pet's health that's safe. I'm a big fan of tooth brushing and tooth wiping. Even using something like a soft or slightly firmer bristle toothbrush can help to remove plaque and can help to prevent dental disease. Cleansing wipes also can be helpful, but they're not as effective as brushing because they don't get between the teeth. But before we go there, I actually just want to take it back to, where does periodontal disease start from? Periodontal disease starts from the deposition of food debris on teeth, and that can occur within 2 hours of eating or within 2 hours of dental cleaning, brushing or professional cleaning. And it all starts with plaque, which is an invisible film that can over time become tartar, which is yellow or brown, and over time that progresses to calculus, which is a thick shell that is firmly adhered to teeth that has to be scaled off. That does not come off with brushing. And all during the plaque tartar calculus process there is gingivitis, which is gum inflammation. And when gum tissue becomes inflamed, not only is it uncomfortable for the pet, and it could affect their ability to chew and eat and swallow, but it allows bacteria to get from the mouth into the blood, and through the blood it streams and ends up on the heart valves and the kidneys and the liver and the pancreas. It can be found even as distally as joints. So it's really crucial that we always think about, from a lifelong basis, trying to promote periodontal health.
So what you eat matters.
Absolutely. Thank you for bringing that up.
What you put in that mouth matters. So sometimes I feel like a broken record harping on natural nutrition, but I think when we're trying to figure out what to do preventatively for our pets, we should think about what they would eat in nature. So I am big on the predators, the carnivores eating a prey concept diet. And in there is going to be the flesh, the organs, the little bit of vegetation, but most importantly the bones. And as veterinarians, we're often taught and teach our clients to never feed bones to our pets, and how ridiculous is that when that's what they eat in nature. But the key here is safe bone size. Also that those bones need to be raw, not cooked. So we've all removed bones from the intestinal tracts. They can wreak terrible bloody havoc in there, but not if you're giving the correct bone size to the correct size pet, and raw. And so recently, my own personal experience, I have have many animals, but I have one cat that is now 18 years old, and I felt that he's had some dentistries over his lifetime, but it was time where I was getting a little nervous that he's older, and I preferred not to put him under. And I have been feeding him raw, and his teeth aren't bad, but he was getting a little calculus. And I have never had in my own practice, I sell a lot of raw diet products, but I didn't have the proper bone size for cats. And so, or for that matter, little Yorkies and some of the little dogs. And so I found a source to get whole quail. And it was absolutely amazing. I was so excited. I took a little video of him crunching. It just took him a second to figure it out, and he's crunching away on those quail bones. And so raw bone can actually remove the hard calculus that you're talking about. Not as effective as the dental scaling, but it can especially be effective if you're using it preventatively. So I wish I would have started with the quail at a younger age, but I sell things like duck necks. Duck necks are a long bone that they're not, a dog isn't going to suck it down whole. Sometimes even raw chicken necks I get nervous about because they're short, and so you have to think again about the size of that dog, and a duck neck is a little longer and slimmer and safer, and they really have to crunch it down. When I'm counseling people how to feed raw bones, I tell them that they should be rotating the different types of bones, marrow bones, knuckle bones, depending on the size of the dog. I discourage everybody from turkey necks. There are a lot of instances out there where the vertebrae of a turkey neck is too large for any size of dog. Also, when I hear somebody say, oh, I can't feed raw bones to my dog because he gets diarrhea, I know right away that the kind of bone that they gave him was a marrow bone, because of course bone, the calcium in the bone is very firming to the stool. It doesn't cause diarrhea, but marrow sure can. And so I simply tell them, thaw that bone out, scoop some of the marrow out, just throw it away, and leave a little in the center so they have something to work for. But then that's another bone style that they're going to chew on differently so that they can really clean all the different surfaces of their teeth.
Yeah, and I'm a big believer in bones, and even go one step further, and a lot of people disagree with me, but I encourage raw shed antlers of elk and deer as well, because they last long, so they're very cost effective and very effective. The caution, of course, is they are so hard they can break teeth, and so we need to use them judiciously. But in use of all bones, studies show that we still don't get the very back teeth. The construction of the commissures of the mouth of the dog are such that it's very difficult to clean the very back teeth. And I think it goes back to what you said, Patrick, that even though we're giving bones, we can't be complacent, and we still have to do some oral hygiene on those back teeth. And those carnasal, those back carnasals, are the ones that give the veterinarians the biggest fits when they get infected and start causing ulceration under the eye and whatnot. So yes, bones I think are a way to go, but we can't forget that that's the only method of health.
Right.
And there's times that prevention isn't enough, and pets have to either go under anesthesia to have a dental or have a non-anesthetic dental. The anesthetic dental is the most effective way to go. Part of the importance is that the anesthetic dental is the safety of it, because you are putting a tube in the dog's trachea to protect it from bacteria getting into the respiratory tract. That tube inflates with a cuff to help to prevent that bacteria and all the liquids and garbage from the mouth getting down there. And so that allows for the safety. But then also under anesthesia, the veterinarian can fully determine the amount of pocketing around each teeth with the measuring tool. They can scale under the gum line. They can take dental x-rays, which is really a very crucial part of the dental, because a lot of dental disease occurs under the gum line. And what you might see with the naked eye when you look with x-rays, you might see that there's alveolar bone loss, and you don't want to just wait until a tooth is loose. Sometimes you have to take it out when you're starting to have that bone loss. Not everybody does x-rays, but it is an important part. Even if you didn't do x-rays and you scaled under anesthesia, that's still better than doing nothing. And if you are, don't be afraid of anesthesia. Anesthesia is not going to kill your pet. Your pet may be too unhealthy to go under anesthesia, and that would compromise would make more of a concern. Your pet is never too old to go under anesthesia, so we want to make the pet as healthy as possible and then put them under to address the disease, because if you're not addressing the disease, then you're going to have so many other problems. But with non-anesthetic dental too, it is not right for all pets, but if it's done professionally for a pet that has mild disease and the pet is cooperative, it can be very effective. And in California, the legality around the non-anesthetic dental changed, I think in 2012, somewhat recently. And it now has to be done legally by a registered veterinary technician or a veterinarian, not a groomer. Groomers, though, may have done a good job back in the day. Now they would just have to get advanced training to be able to do it, just so that we can really make sure that we're identifying dental disease. Because if, say, the owner is afraid to put the pet under anesthesia, they're only getting non-anesthetic dentals. I've seen times before when that's being done, and there's teeth that are sitting there like waving at you inside the mouth because they're loose, and the owner doesn't want to have those teeth removed, and they're causing a problem. And the non-registered veterinary technician person who's cleaning the teeth is not fully addressing the problem, and the owner thinks, okay, I cleaned the teeth, everything's great. It's great that some of the plaque and tartar and bacteria has been removed, but they really need to go for the full Monty.
And as far as any fear of anesthesia, and you're right, it really has nothing to do with the age. It more has to do with what is their underlying health, what is their liver, kidney function, and their heart function, and can they handle that anesthesia? Could be a problem even when they're young.
Yes.
Pets can be born with cardiomyopathy. That's one of the disorders where if you hear a horror story, that animal succumbed to death due to the anesthesia, it could be that everything was administered totally properly, but the underlying cardiomyopathy wasn't diagnosed. Right. I really require and encourage pet parents to make sure that let your veterinarian do a good thorough blood panel, and not all blood panels are created equal. We like a test, it's called a proBNP. I call it a heart screening test. It's not a perfect test. You can get false positives, but you don't get false negatives. And so if that test comes back normal, that means that that pet's heart is fine for undergoing the anesthesia. And then in the breeds that are predisposed to heart problems, Cavaliers, Boxers, Dobermans, that would be a good test to make sure it's included in the blood panel. Also the breeds that are predisposed to hidden liver disease, like Yorkies, make sure that you add in a bile acid panel to that pre-anesthetic planning. And then you'll just have a lot more peace of mind, and your veterinarian will have a lot more peace of mind putting your pet under for that dental.
Yeah, and I'm a real big proponent of the non-anesthesialist dentals, but even I am very judicious about who I send for such procedures and what the scope of, I think, that procedure can do. Because anesthesia is a big fear for pet owners. But I would like to tell you, having been in this business long enough, that when I got out of vet school, anesthesia consisted of taping a syringe of sodium pentobarbital to a vein and injecting it as needed, to now anesthesia is completely different than that. It doesn't take 2 days for an animal to wake up like it did from a spay back in those days. And so our monitoring is much better. And so even though I've experienced the whole breadth of bad anesthesia to excellent anesthesia, the thing about anesthesia that we need to keep in mind is that your dog is at greater risk driving to the hospital than actually under anesthesia. And so even though I am very guarded in my use of anesthesia, one has to look at relative risk. And the other thing with regards to risk goes back to what Dr. Mahaney said about chronic inflammation. The leading cause of death in dogs right now is cancer. 1 in 2 dogs is going to get cancer. Chronic inflammation of the gums can lead to oral cancer. The prevention of dental disease is extremely important for this major health concern.
And with that, so you can prevent, my own dog who's no longer with us never went under anesthesia for a dental because I committed to myself from puppyhood to brushing his teeth every day. I used a soft bristle toothbrush, and I personally find soft bristle better because a lot of dogs and cats already have gum inflammation. If you get in there with a hard bristle toothbrush, you can create more inflammation if the pet isn't cooperative and the owner's a little overzealous in their scrubbing. So every day I brush Curtis' teeth. The last thing before he went to bed, when he's already in bed and he's calm and receptive to it. But I got him used to it right away. When he had his puppy teeth, I would lift up his muzzle, I would take the toothbrush and touch it to his gums, and he just accepted it. He didn't love it, but he accepted it, and I was able to prevent him from ever needing to go under anesthesia as a result. And the thing is, if you don't do the preventative care and you let your pet have advanced disease, there is going to be more of a risk for anesthesia. There's going to be a higher likelihood of dental extractions that your pet's going to take a couple days, maybe upwards of 7 to 14 days to fully recover from. There's going to be pain associated with the healing process. So it's really crucial to think about prevention. And just using that soft bristle moistened toothbrush, maybe some liquids or toothpaste. I'm not personally a big fan of toothpaste. I don't like the sugar alcohol that goes in there. Xylitol is a known toxin for pets. It is often consumed in sugarless mints and gums like that. But also it appears in some pet toothpaste. I'm like, why are you putting a known toxin into the pet toothpaste and you want the pet owner to every day brush the pet's teeth? It just doesn't really make sense to me. So even just a moistened toothbrush is going to be effective. Taking a cotton swab, putting it on your finger. I don't mean like a soft cotton ball, but a square, just that little bit of that abrasive effect. Yeah, that can help.
And it's easier to train people to utilize that initially too. It's not so much either the difficulty of doing it, but it's getting in that new habit.
Right.
And the other thing that's sad is sometimes they have the dentistry done and then they don't get on top of the care after, and then 6 months later the teeth look like they did before the dental. So I think that if we can get out there and train people to even start with just their finger with a little yummy coconut oil on it and get that in, and it's easy. with your finger to feel those back teeth that you were talking about, those molars, and you're just pulling the cheek out and slipping your finger in there and getting them a taste of just plain coconut oil. And then, you know, we're into the essential oils, putting, there's different blends you can use that'll have clove in. Traditionally, people would put clove oil on their baby's teeth for teething, and we can do that even in puppies. I mean, there are some puppies that have very sore mouths when they're teething, and even getting diarrhea from the stress of that. And so clove oil can be helpful, and that's one of the oils that you put just a toothpick tip of that oil in with the coconut oil, and then that'll have some antimicrobial impact too, and you can start massaging that in there. Yeah. There's also a product on the market that is an esterified fatty acid, and so if we notice at a dentistry that there's a gingivitis going on and that gingiva is starting to lift away from the alveolar bone, this esterified acid can, fatty acid is a gel cap, you poke it, squeeze it, and massage it in their mouth, and it can help adhere the gingiva back down to the alveolar bone. So we want to make sure that after you invest in that dentistry and that concern, that you then get on top of that preventative care.
Absolutely.
So as you can see, dental care is more than just a beautiful smile. It really is one of those keys to overall health. Make sure you're working with your expert. Thanks for joining us here on Natural Pets TV. Hey everybody, a lot of great information, a lot of great discussion going on here, and we want to keep that going in the comment section down below. Now don't forget, you should subscribe to this channel because we've got more great guests, more great episodes coming throughout the year, so please subscribe. And if you want to find out more information about our guests, I'm going to tell you how right now Dr. Ken can be found at thewelldog.com, Dr. Jodie at drjodiesnaturalpets.com, and Dr. Patrick at patrickmahaney.com. And as always, you can reach out to us at Pet World Insider. All right, folks, thanks for joining us. We'll see you soon.